you guys got your mics on? Kurt, is your mic?
Green light.
Is mine on?
Push the button, right?
No, it's on.
There you go. Perfect. All
Is
right.
that better?
Yes. All right, I think it's time to get started. I'd like to welcome everyone to our weekly COVID press conference. Today we're joined again as usual by Dr. Bill Remington from the Kosciuszko County Health Department, Commissioner Carrie Groninger as a Kosciuszko County Commissioner, and our guest today is Kurt Carlson from the Bowen Center, talking a little bit about the difficult mental health side effects of this whole thing, and I know Kurt's got a lot to share. We've got a lot of information today and a lot to get across. Before I start, though, I just wanted to address the social discord that's currently gripping our entire nation. Earlier this morning, I, along with Chief Whitaker and Sheriff Dukes, met with organizers of this afternoon's protest of the wrongful death of an African-American man in Minneapolis. We assured them that we agree these actions were unwarranted and was yet another example of racial bias. We also assured them that their opinions are important, and like everyone, they have the right to express their concerns in a lawful manner. We have a rich history of our country being a destination from all over the world. Our communities reflect that. We are proud of the rich diversity of our community. So, that being said, let's move into the business of COVID. A lot to talk about. First thing I want to discuss is that we are announcing that COVID testing has begun this morning at 7 a.m. at 3 MedStat locations in the county for county residents, testing for county residents. County residents will be asked to present an insurance card to pay for that, but if they have no insurance, the testing will be done at no charge. The testing is being supported by CARES Act allocations from both the city and the county. We have an MOU to provide funds for the testing. The testing will, the city is providing $100,000 of CARES Act money. The county is providing $200,000 of CARES Act money. We will, that allows us to do a maximum, to support a maximum of up to just a little over 2,000 tests. So we feel comfortable that this is important, given the increase in numbers that Dr. Remington will talk about today. We identified a concern late last week, moved rather quickly to get this done. We're happy to partner with MedStat, their availability, their accessibility as drive-through testing site, 3 spots in the county, and the press release will list the hours that those tests are being performed. But I can tell you, MedStat in Warsaw is 7 days a week, and I think during the week it's from 7 a.m. to 8 p.m., so there's ample availability and accessibility for that testing. Again, the press conference is going out as we speak. It will list the locations, Warsaw, Syracuse, and Napanee, the times, the addresses. It will also list a web address that one can register online. It's not required, but it might expedite that testing experience if that information is filled out online. So that information will also be in the press release. Testing will be on demand for those with symptoms, those who are at risk by age or other health conditions, or those who feel they've been exposed. I think I'd mentioned last week that, or maybe it was Friday at the Board of Works, I talked that we have been in contact with the Governor's Office and the State Department of Health with regards to Warsaw being an Optum test site, in other words, a state-sponsored test site. Again, and that's similar to what we're doing. Those are free testing in lieu of an insurance card. But we were told that, I think because our numbers had been low for so long, we were not designated as an Optum testing site. I did make the request that they keep an eye on our numbers, and if we get to the point where we could benefit from that, they have assured us that they could create a testing site here in our community. But in lieu of that, we felt it important, Commissioner Groening and I had a long discussion and felt like that doing something now and rather than waiting for a state testing site was critical to trying to bat this down. Carrie, any comments on our testing site discussion and what we've done?
No, I mean, I think when we met there last week to talk about this, I mean, it become pretty apparent when we're starting to see those numbers rise that we definitely wanted to try and do something. And after talking with different individuals, we pretty much found out some of the roadblocks or some of the struggles they were having in getting some testing. So, you know, we tried to listen to what they have to say to try and remove those barriers so those that really need to get access to these tests can get that. So, I mean, I think what we're trying to do is really going to be a benefit for a lot of these people that need to have that testing done and don't have the insurance or the means to be able to do that. So.
All right, and thank you so much for, I think the city and county will sign an MOU, and certainly we're all in complete agreement that this is a critical step to try and combat this. And I'm sure Dr. Remington will have some comments on this on-demand testing as we go ahead. Before I turn it over to him, though, I did want to also talk a little bit about a pretty extraordinary effort that initiated Wednesday with a call to a group of local leaders. We decided, when I was made aware from the state health department, the county health department, Teresa Reed in particular, that there was a potential problem. The first thing we decided it was important to get information out to those areas that were or could be considered hot spots if we didn't do anything. The county health department put together a bilingual brochure, English on one side, Spanish on the other. The brochure had a English hotline on that side and actually had two hotlines on the Spanish side. So it was an informative piece that talked about symptoms, what to do if, and it gave good direction and was critical that we get this out. We also have utilized social media to get the information out, but we felt like going door to door underscored the importance of trying to control this as quickly as we could. We mobilized with 3,000 brochures. County GIS told us there was 3,000 mobile homes in the community. We ordered 3,000 door hangers. We got the Kosciuszko County Volunteer Fire Department Association under the leadership of Kevin McSherry. He mobilized those departments in those communities. We also, Chief Wilson and our local Wayne Township Fire Department, Fire Territory distributed the brochures in the mobile homes in our township. We were joined by volunteers from several organizations that I want to read. Zimmer Biomet sent team members. Warsaw Community Church sent team members. OrthoWorks sent team members. Grace College sent team members. And Our Lady of Guadalupe sent team members. We had several dozen volunteers that assisted our respective fire services in delivering those brochures. They finished printing them at 4 o'clock on Monday, and I believe about 80% of them had been delivered by about 8 o'clock Monday night, and the remaining were distributed Tuesday. So a very big thank you to all of those firefighters and volunteers. Also, Bartell Printing did a great job of putting up with our last-minute edits, doing the translation, and making that an effective brochure. Nikki Lalonde at the health department provided the content for the brochure and did a marvelous job. So again, just a
team effort for sure. Pretty
quick mobilization to get this done. And again, I couldn't thank our members enough for that. So with that, Carrie, do you have anything else to add from the county side? Any updates?
Not a lot. I mean, I think just to piggyback on some of the stuff that the mayor just had talked about. I mean, I think when we were just fortunate, in fact, it's just great to see the team that we've kind of have in our community, that when we seen something that had some concern, just how fast we were able to take a possible, concern and be able to implement something very quickly and get that out there and then continue to find solutions. So, I mean, I just think from that perspective, I think we have a lot to be thankful for with the resources we have in our community, that we were able to do that so quickly to hopefully make a difference in our residents. From that, as far as the county itself, we're continuing to maybe install and implement maybe more permanent safeguards in some of our county offices, as far as cootie catchers or whatever you want to call them, that are at some of the where the individuals interact with the public, and making those to where they're a little more permanent than some of the temporary things we had initially. But looking at different options on maybe some online stuff on permitting and other things, that we're continuing to try and make that as user-friendly as we can for our residents, and so they can continue to do business and get done what they need to have done. So, but other than that, on a whole, I mean, we're doing pretty well over the county, so we're thankful.
And again, I just want to continue to highlight and showcase and thank the county for their cooperation. This is obviously, this virus respects no boundaries whatsoever. So a team effort was demonstrated here just earlier this week, as well as now the testing moving forward. So I'm very appreciative of the ability of everyone to come together for this, and pretty much focusing around the Kosciuszko County Health Department. So with that, Dr. Remington, I'm sure you've got a little bit to talk about today.
Thank you, Mayor. And thank you for the coordinated play with the recent chain of events with the COVID outbreak for our county. Greatly appreciated. From my personal perspective as a health officer, our county health department, we are relatively small staff, typical to county health departments, and we simply cannot do this without tremendous community coordination. And we are really uniquely fortunate, I think, to have a multi-agency, multi-jurisdictional weighing in on this. So thank you very much. So Kosciuszko County definitely has a surge of COVID cases. It took us 2 months to go from our first case to our 100th case just about a week ago. We have additionally 70 cases today on top of that 100th case last week. So it's really surging. This is in the context of a significant presence of cases in an adjacent county that's receiving some national recognition for that unfortunate highlight of that county. I think our outbreak is part of that. Clustered housing, probably some shared occupational exposures come to play. Our goal is to mitigate the spread. We certainly are not going to eradicate this virus, but if we can slow it down, not swamp our local hospitals and emergency rooms, that's our goal. And focused testing can help us get there. And I'm all for this rather quickly assembled and innovative approach to creating a lower barrier access to testing for this social set, geographic set within our county. And hats off to my communicable disease staff and epidemiologists for seeing this. This just didn't land in our laps. They had to really parse the data to see this. And I am so proud of them for seeing it and helping us take a targeted approach to this surge of cases. So this population sector that we have been referencing this morning is still just roughly half these new cases. So it's not the entire thing. So again, it's taking a step back. This is part of a regional experience that's not gone away just yet. Looking further a few steps back at the state level and the national level, those metrics continue to improve. The state epi curve is flattening out a little bit, The national curves certainly show improvement, apart from, again, some hot spots geographically here and there across the country. So yes, we are experiencing a surge, but in the context of the USA experience, which seems to be improving, perhaps our surge will phase out a little quicker, we hope. But I am anticipating this will be a multi-week surge. That's typically how these have played out. If I look at the epi curve from certain other regions around the country, we perhaps are following just about 6 weeks apart from what some experiences had been elsewhere. No one can perfectly predict what this surge will look like, what the legs will be like, but I'd ask that we continue as a population to be invested in things that flatten that curve. That helps us. Spreading it out helps us. It may drag it out a little longer, that's for sure. And maybe why we're seeing this now, it could be that our late coming surge is because we had been so invested in social distancing and hand washing and masking and stay at home for the last 6 or 8 weeks. But you just don't perfectly know why our surge is coming now. But I would ask, as tired as we all are with some of these interventions, that we continue to stay the course. I think the reopening plan from the state governor's office is still appropriate. Our aggregate numbers per population remain low in our county so far compared to neighboring counties and compared to state or national data. This county per population still has a low rate of COVID-19. So we stay the course with the opening up, but I think we need to keep our heads on. So if you're in a congregate environment, you can't help but avoid it, please have a mask on. Outdoor spaces are generally safer than indoor spaces. If you're ill, please don't go to work. Work with your employer, and if you're an employer, please allow appropriate HR policies that allow ill people to stay home. We will continue to do case investigation and contact tracing in parallel with the state's contractor. We continue to desire to look upstream with any new cases, looking for root causes, just as we did over the past several days, trying to target resources as we look to root causes perhaps, or root or focal geographic centers. That's our goal. If the numbers become just untenable, then it's more difficult to have that type of a posture. But I just need everybody's ongoing efforts to be mindful of this pathogen, which is respectable. Most people will do well with an infection, but it's very clear now, 2-3 months into this, that there are certain quite vulnerable subgroups, in the elderly particularly. And if nothing else, wear that mask to protect someone that you may not even know that's in proximity to you. So thank you again for all the efforts of the last several days. That was quick, and you weighed in strongly with us just demonstrating data to thinkers in our midst, the mayor, the county. Our goal as the health department has been to be very transparent with the data as we see it. We may not perfectly understand it all, honestly, but at least we can share it. You can help look at it with us. We'll weigh in professionally, but we need good thinkers helping us. So thank you very much.
Well, thank you, Dr. Remington. I know your office has been very busy. Again, looking at kind of over the next few weeks, as we as local leaders weigh in the reopening plan, I know with the surge, we're going to be very cautious about what happens on June 14th. And there's also, as we mentioned, some of the surveillance testing that I think starts today, and we should maybe have information late next week. So we're keeping an eye on those numbers, and as I've said all along, and utilizing the data that's coming from the county and from the state are going to drive our decisions. And we will be monitoring that data. We're still in phase 3, and we're not looking ahead to phase 4 yet. So maybe an extra inning or two.
I'm afraid so, yeah.
Okay. All right, Kurt, we always ask Dr. Remington to use the analogy of a baseball game, and we've played through a full game, and I think we might have a pitching change here, and we're moving into a few extra innings, so, but hopefully not a doubleheader. So Kurt Carlson is visiting us from the Bowen Center. We all know the stress and anxiety that an unknown menace is causing people. Certainly the uncertainty of where we go, the impacts from our economy and being laid off are weighing heavily on the mental health of our community. And again, I don't think we're any different than anywhere else, but this is an area that I know Kurt and his team have been at the forefront. We've had medical guests here, and now we need to look more at the mental side of what's going on. And I've asked Kurt to come and talk a little bit about what he's seeing in the community and how Bowen Center and other organizations are helping try and provide some relief and a little bit of recovery, if you will, for those experiencing mental distress. So, Kurt?
Thank you, Mayor. Again, Kurt Carlson, CEO of the Bowen Center. Let me start out by giving you a phone number that if you need help, call 1-800-342-5653. That's the Bowen Center's number to schedule any kind of appointments. And we're actually having great success getting people in same day, next day, unless that just doesn't fit in the patient's schedule. But let me give a little history about what happened when the governor, staff aren't here, and then the patients don't get served. So it's a three-legged stool, but we wanted to make sure that the patients got treated. The head of FSSA, the federal government at various branches, they all made telephonic services possible, removed all the barriers. I have not seen such a great movement at the federal and state level so rapidly, and it was absolutely the right thing to do. And so our psychiatrists, they actually didn't take much of a dip at all in their services, and they are now actually seeing 10% more patient visits than they did before the pandemic. And they're working from home, their teams are well-oiled. Like I say, it took them a couple of days to kind of come up to speed, but it's been amazing. And one of the things that happens is if they have a no-show or cancellation, they can reach out to a patient and put them right in that spot. And we had one case in Indianapolis. It was a complicated case of a girl with a serious medical problem and also a psychiatric problem. They reached out to Bowen Center. One of our child psychiatrists said, I've got room in my schedule 2 o'clock this afternoon. So same-day service from Indianapolis to Fort Wayne. This is really a useful tool that we hope never goes away. Then our outpatient staff who do talk therapy with their clients, took them about a week and a half to come up to speed. They're now seeing about 5% more patients than they did before the pandemic, and it's working really well. The group that had the most difficulty were our school-based therapists. They were the ones who were in the school, and basically summer came 3 months early. And all the areas where they would have seen them in the summer are all closed. Boys Club, Girls Club Y, etc. And so the ones who had worked with the school and the patient in the school and also with the parents, that was an easy transition. They'd already had an established relationship with the parent and the child in the home. The ones who hadn't done that, they've struggled a little bit. So we're now up to about 89% of where we were in January. which was our high point for the year. And so we continue to be available to serve patients in this and the other communities that we're at. When the governor issued his staged reopening plan on a Friday, by Monday we put the beginnings of the plan together. By Wednesday we activated the plan. We started reopening our offices, having our skills coaches out in the community working with their patients. Again, that wasn't all. Many of our staff and all of our psychiatrists are still doing their services telephonically. It's working. No need to reverse that. And again, my plea to the federal and the state government is please allow us to continue to do that in the future. We did not furlough anybody. We didn't lay anybody off. We didn't close any programs. We just provided the services differently, and the patients appreciate it. So let me say something about pandemic fatigue. As the mayor mentioned, this is very stressful. We've never experienced this before. And so it's not uncommon for people to have a whole wide variety of emotional reactions to that. So for example, if you're experiencing irritability or stress or anxiety, or you're eating more or less than you used to, if you're not sleeping well, if you're unmotivated, if you've got racing thoughts, feeling rage or on edge, you've got pandemic fatigue. You know, we have fears of this for ourselves and for our family members, for our neighbors, getting sick and possibly dying. As I mentioned to Dr. Remington earlier on, my oldest daughter is a nurse in a hospital in Illinois that has seen the third largest number of COVID patients in the whole state, and she literally watched people die every day. And so for myself, that's stressful. I mean, I'm so appreciative of what she's doing and so proud of her, but I'm also scared. I find myself, for instance, I'm usually emotionally pretty controlled. I find myself tearing up much more often. So none of us are immune from this. It's a matter of how do you cope with it? How do you maintain that resilience? You know, the loss of income as well as the fear of the disease, the loss of jobs within families. You can't say goodbye to loved ones who might have passed away because of this. So a whole lot of factors, and then you're trapped at home. A lot of people just didn't go out for a variety of very good reasons. So it's normal to feel frustrated, anxious, depressed, angry. Children. I'm very concerned about children, with the Division of Children's Services and schools not having eyes on children. We didn't either because we're doing things telephonically. The rate of domestic violence probably went up, but we don't know that for sure. So as the society opens up again and we're out in the community, then we'll have eyes on those children, and hopefully we'll be able to detect or prevent any abuse in the home. And you can understand how tension in parents would result in lashing out at kids, because kids experience emotional stress in various ways. And we could easily see them as being naughty or bad and needing punishment, when in fact they could just be stressed and anxious and fearful, and they just act in a way that triggers the parent. And so we really need to make sure that we learn how to cope with the stress as a parent and help our children cope with their stress. We need to be patient, we need to be understanding, and not jump right to punishment. You need to stick to a routine, both for yourself and for your kids. Structure and built-in playtime, again, both for adults and for kids. Social emotional development through peer interaction is really difficult. Children need that interaction on a regular basis to learn normal social skills. And so how do you do that? I mean, there's FaceTime now, we're able to get out more, but we need to try to have ways for kids to stay in some contact in a healthy way with their peers. We really need to limit screen time, social media, and the constant deluge of the media. television, radio, whatever. Sometimes I just have to turn it off. I just can't. I can't keep doing it. Self-care is very important. So please, schedule time every day to do something that you enjoy. Schedule it. Make sure you do it. Not an afterthought, but a forethought. If you like reading, watching a movie, taking a walk, doing exercise, meditate, chat with a friend, whatever. And when you have troubling emotions or thoughts, allow yourself to study those. Go with it. Examine it. See what it's about. Try to get past it, to develop that resilience. Again, fear, depression, anger, sadness, anxiety are all part of what we're collectively experiencing. At the end of each day, I'd suggest that you inventory or think about all the things that you did that added value and meaning for yourself, for your family members, for a neighbor, for society. When I hear about this group of volunteers who just spontaneously went out and in 4 hours they got this task done of distributing those brochures. At the end of the day, they should really inventory that was a really good thing to do and feel a sense of joy in that. We need to build resilience. If symptoms persist and they interfere with your day-to-day functioning, please seek professional help. Again, the Bowen Center number is 800-342-5653. There's also the 211 hotline, and there's a new website called Be Well Indiana. And so just seek help, whether it's at Bowen Center, which we would be glad to help with you. Again, I've got 1,500 employees, and we're now spread over 27 counties in the state. But most of our services are delivered within our core counties, including Kosciuszko County. So we have a full group of staff who really, really want to help. There's all kinds of self-help guides. Here's one from working from home with your children. And Dr. Liebetrau, who works for us, created this, and the headings of these sections: maintain routine as much as possible, have cognitive flexibility. You know, that child may not understand you've got something else to do and they're wanting to demand your time. We need to be flexible and forgiving of ourselves and pay attention to that child. Avoid overexposure to news media and social media. Expect a range of emotions of yourself and your children, and focus on what you can control. There's a self-care wheel that talks about the physical, psychological, emotional, spiritual, personal, and professional. And all these things need to be kept in balance, and that's very hard to do right now. And there's a checklist like the self-care activities. And just inventory the things that you like to do and give yourself the space and the time to commit to doing that. And the same thing with your children. So, Mayor, thank you for the
Yes.
opportunity of presenting.
Kurt, thank you. I know we've all felt a few of those symptoms that you described, and again, there's ups and downs. This, I think, I know early was changing so quickly. It really created a lot of anxiety. So thank you for what you helped us with today, and your commitment in our community to getting us through this thing. So any comments before we move on to questions? All right, Nick.
Can you just re-clarify earlier from when we were talking about the testing, who is eligible for the testing?
Any resident of Kosciuszko County is eligible for on-demand testing. Bill, would you, or Dr. Remington, would you describe what that means?
Yeah, so again, Kosciuszko County resident, because we have county funding partnering with this. So symptomatic patients and a growing list of people with no symptoms. So contacts, very suspicious that you're a contact, high-risk group, 65 and older, significant underlying health conditions, certain demographic groups, racial groups. Those are the people we want to test. So it's still not wholesale testing, it's just short of that. It's getting pretty close to that. but still try to keep some semblance of a targeted approach to testing. You're more likely to have a test result that means something when you take that approach, rather than wholesale testing where you start to get into some aberrancies with that. And we only have we have pretty robust resources, but it's still finite, it's not infinite. So symptomatic and a growing list of people who have no symptoms, largely though springing from a contact concern.
So wholesale testing, an example would be if an employer felt that he wanted to have his entire
Right.
company tested.
So, right, those are interesting to observe and get complex. I wouldn't say I have the final word, yay or nay on that, but the more you test in a low prevalence setting, just in general, the more problems you have with really having pertinence to the results. But we know that this virus spreads with no symptoms, so if you have a very high-risk setting that has concerned you, the classic example is a nursing home, then there's a growing body of evidence, a growing body at least of approach that includes surveillance testing, more closer to that wholesale testing idea.
Yes, so again, just to clarify, this is on-demand testing for, again, those with symptoms, those who feel they've been exposed, those who are at risk by age or comorbidity. So,
Probably the only other thing we would add is, I mean, if they have insurance, they're still gonna bill it to their insurance card, but if, for those that don't have insurance, is what the county and the city is willing to pick up the cost for.
and that models the Optum testing
Right,
sites from the
for the
state.
state.
They're asking for an insurance card. If you're covered, they will bill the insurance, but if you don't, it will not preclude you from being tested. So, free news.
In general, if you live in a mobile home park, would that qualify you?
I would say no. If you live in proximity socially to someone who is a COVID case or you have high suspicion, and you live in a mobile home park, yes. If you have a mobile home park that's had a number of cases, you've anecdotally heard that, half a dozen, 10 people, and your kids share the playground, share the pocket of the neighborhood, and you have concerns that because of all that, you really have a contact risk, then yes, get tested.
Also, I was talking to your epidemiologist who expressed some real frustrations in trying to work with the state in terms of this, when the state moved in and took over contact testing. My terminology might not be right. And I guess it just did not go as well as hoped. And then I believe the county is now reasserting its role in that. And so I'm curious how much of maybe that has contributed to where we are now.
I think we've had to learn that appropriate interface, and we're not the only local health department that's had to learn that. The database became different, and we knew that we were going to have a shakeout point with that. My personal philosophy has been, as I mentioned earlier, is to not give up on upstream thinking in our county. I don't believe we're at the point where a robocall telling you that you're a contact and consider quarantining for 14 days cuts it. I don't think there's huge traction with that, at least not that we're willing to go to just yet. At our numbers, with our resources, we can think upstream, think of targeted testing, find root causes if we can, and try to have more focal and I'd say meaningful messages with individuals. People respond to a phone call from Teresa or Nicole. They do. And the callback rate, as I've heard with the contractor, isn't the greatest. I mean, we appreciate the contractor. If our numbers get in the several hundreds, 1,000, 2,000, and I hope we never do, I could see I could see why a state Department of Health makes a contract like that. You gotta get some resources here. And I suppose if you're in one of these really, a real hot spot, like a New York City, Indianapolis was pretty hot there for a while. There is no way you can do the type of case investigation, contact tracing that we have been providing in this county. So you are hopeful just to bend the ear of someone on a telephone saying, hey, quarantine for 14 days. We think you're a contact. Or you have a case, hey, we hear you have a positive test. Tell me who your contacts are. Who's in your household? Do you have contact information for them? Because we're going to call them and tell them to consider quarantining, that kind of thing. So it takes an army to do that, and that's why so many states, including ours, are doing these contracting options where they quickly put together a phone bank of several hundred people to do this phone calling. So we will continue to interface with that, and we appreciate it. It's something. I mean, we'll take it. But I want to continue to think upstream, and I feel I want to offer that service to our county residents.
Yeah, I think we've been fortunate here that our numbers have been low. We've been able to watch this unfold, and as it comes to our doorstep, we're ready. And I think we showed that this past week with getting the testing started, and I think, again, having the lower numbers and the staff and the expertise to do the contact tracing has been to our benefit. But the state, as you mentioned, feels the need where there's areas that don't have that expertise or have these great numbers. I think it was a good move, but I think we kind of decided that our system's continuing to work pretty well.
Yeah, and the state realizes all these issues, and they're working on
Yes.
refining that interface with the contractor.
Yeah, and we were fortunate that Nicole was available kind of at the very beginning of this. She had been an intern at our health department over the last couple of years, so we were able to bring another person on board in a time when we really needed that extra horsepower.
Absolutely.
So that was, I mean, Bob Weaver having that contact has been an immense help to Teresa as well as our community. So.
I agree. Thank you.
All right.
I had a question come in asking if there is a way to make employers accountable to the propagation of the virus, asking if there needs to be like a number of cases in any of the bigger companies or employers before there could be like a quote-unquote forced shutdown of some sort.
That'll vary from state to state depending on the motif of the opening up philosophy. So Indiana is very business friendly. That's good. So we will go to a plant closure very slowly in this state. So, and I'm all for that. There are ways to do this on a targeted basis as long as you have a willing employer to work with you and invest it. And we've had many examples of that in this county. We've had tremendous play with a number of large employers in that regard. If we sense there's a real brush fire in a particular place and our work locally is just not cutting it, we will call in a state strike team. And they will assess it with fresh eyes on it and go from there.
I know I've had concerns expressed to me by employers that they want to do everything they can to protect their workforce. And that can be something as basic as taking temperatures and social distancing and all the things we ask them to do, but, making the decision to lay someone off or to furlough them is a very difficult decision as an employer as well. But Nick, I think your point is very well taken. There's a tipping point there that I do believe there are resources to address. And have you had any discussion regarding that industry or?
Well, I think, Dr. Remington keeps us abreast if there's a particular employer that's targeted. And I mean, he's been very good at just trying to sit down with those employers and making sure we're doing everything we can to help them. And thus far, everybody's been very open-armed to try and make that happen. And I don't think anybody's out there trying to get their employees sick or cause health issues. That that, but at the same token, this is all new and everybody's trying to feel their way through. And obviously there's people from one spectrum to another that are, are really, really fearful or have a lot of anxiety about it. And then there's others that are, full steam ahead and I don't need any of that stuff. So, I mean, it's trying to find that middle ground that truly, is going to keep everybody as safe and healthy as we can, so.
I had discussions with some employers early on, some large employers, and, we've got a lot of people coming into this community from outside, from other counties. I spoke with the mayor of Elkhart a couple days ago, and he told me that, they got the same issue with their factories up there. They got a lot of people coming and going in their counties and their communities, and it's a balance of public health information. I know they have that concern in Elkhart County right now, that the manufacturing, is potentially contributing to this spike. And it's the idea is to try and prevent that wildfire from getting started, which I think we've done a very good job with. I think for the most part, everyone understands the importance of it, but the economy has to continue at whatever rate is allowed by the public health sector, let's put it that way. And I think that's really what's happening. So.
Can I add to that?
Sure.
I feel I should maybe make a comment as to what this latest surge is not springing from in light of this discussion. It is not springing from a large agribusiness entity. It is not springing from the medical device sector. It is not springing from a single or any of our nursing homes in this county. It is not associated with a healthcare facility. Okay. We are looking for those kinds of things as we look upstream. Okay.
Thank you. Good question. Mr. Spalding?
Mr. Carlson, I'd be curious to know how many new patients are you seeing as a result of the pandemic?
I don't have an exact count, but I would guess if we had 40,000 patients in January, we're probably seeing 5 to 10% more now. And some of these are from elsewhere in the state where they can't get services.
And you use the term pandemic fatigue. Is that a kind of an accepted term in the mental health kind of?
Yeah, I mean, we're all getting worn down by it, and it's due to this pandemic.
And one more. I'm curious about substance abuse people that you work with. They rely heavily on support groups and meeting together. How tough is it for them, and what are you doing to offset that?
I'm glad you mentioned that. We immediately shifted to telephonic and, to the degree they can, visual, like Zoom and things like that. We continued to do the groups, and I was pleasantly surprised that people continued to participate, and even at a higher level, because there were no inconveniences. I mean, sometimes people have real problems, like their car breaks down, or they can't get off work, or whatever. And by doing it telephonically, all those reasons for no-shows and cancellations, many of them went away because they don't have to travel. And so our participation in substance use groups actually increased. And their frequency of coming, and again, coming to every session is not always possible, but we've actually increased our show rate for substance use groups services.
All right. Anyone else? I know, again, there was a lot of information today. Appreciate, if there are no more questions, appreciate your time. And again, I think I mentioned last week I was trying to decide how long these press conferences would go on, and I must have snake bitten myself because obviously there's been certainly a need this week to continue. So we will continue weekly. hopefully we'll get to the point where we can slow these down and stop them. That's everybody's goal. But for now, we'll meet again next Wednesday, 10:30. And again, thanks, Kurt, for coming, and Commissioner Groninger, and as always, Dr. Remington. All right, thank you all.
Thank you very much.
Kurt, appreciate all the services your company's providing, because I think that is definitely at this point very much needed. We're fortunate to have you guys here in the county.